Joining us now to talk about the state of the country right now is Amesh Adalja, senior scholar at Johns Hopkins Center for Health Security. Amesh, we hit 250,000 deaths today. Take a breath and give us an idea of where your mind is tonight, considering that number.
What I think about is the fact that it didn't have to be of this magnitude, that if we would have acted decisively, January, February, March, or even during the summer surge, or even today, we could really blunt the number of deaths. This was a pandemic that has been mismanaged from the very start, and everything that could go wrong in the United States has went wrong. And I do think this really should get everyone, that all of the viewers, everybody in this country, galvanized about making pandemic preparedness the national security priority that it should be, and that we have to get this right. We can never allow this to happen again, and we still have to get through this pandemic. So this is something that I think is a very, very the opposite way that you'd want a pandemic to go.
Amesh, having said that, you know there are a lot of people who think this is not as serious as others. There are some who refuse to wear masks. There are others who are just suffering from virus fatigue. What would you tell them tonight?
That this virus doesn't care if you don't think it's real. This virus doesn't care if you have pandemic fatigue. It will thrive on social interaction, and it will infect you, and it will infect other people. We have to actually start to begin to believe that we're in a pandemic and actually behave the way you should behave in a pandemic. And that doesn't mean that you have to lock yourself in your home. What that means is you've got to follow common sense precautions when you're around other people. Wear a mask, wash your hands, try to avoid congregated settings. Just really think about what you can do to minimize the harm that this virus is doing to you, to your family, to your community, and especially to your community hospitals. I mean, that's the big thing that we're worried about, is hospitals getting into crisis. And I think it's really important that we realize that our actions are directly impacting our community hospitals' ability to provide care for when you have chest pain, when you have a stroke, when there's a car accident.
Is that your metric of how serious this is, Amesh, the hospitalizations? What are you watching, and what do you think would be the best reflection of where we stand now and how serious it is?
What I worry about the most is hospital capacity. I keep a close eye to what a hospital is doing in terms of its ICU beds, its personal protective equipment, its staffing. That's what flattening the curve was all about. It was trying to stay below hospital capacity. And there are many parts of this country, places like El Paso, Texas, places like Wisconsin, Utah, North and South Dakota, where we're really worried about the hospitals. And I think that's what we have to keep an eye on, as well as what's going on in the community in terms of the percent positivity of tests. And there's some places where it's really inordinately high, and that really tells you that there's so much community spread going on. We have a lot of work ahead of us, and we're going into these colder months when we know this virus is going to transmit much, much more efficiently than it had in the summer.
Amesh, this is the first time we've been able to talk since the news came out about the vaccines, the two that certainly showed promising effectiveness. What are your thoughts on those two?
This is great news. These are kind of the light at the end of the tunnel, but we're still in a tunnel. So I do think these are going to be the ultimate solutions to this pandemic, but we have to get to the point where this vaccine is available to the general public, and that's going to be well into 2021. And there are a lot of distribution issues to figure out. One of those vaccines requires an extreme cold chain. It has to be kept at -70, -80 centigrade, and that's going to be something that's going to be challenging even in the best equipped cities to be able to handle. So we have to continue to do what we're doing, knowing that the vaccine is coming, but we have this interim time where many people could die, many hospitals could go to the brink if we don't start behaving the way we need to during a pandemic.
Well, having said that, I think we all know the answer to the question, but we just have 15 seconds left. Amesh, your thoughts that a lot of folks are going through right now about the holidays and Thanksgiving ahead. What should they do?
They really need to think about their risk tolerance and realize that when you invite people to sit around your Thanksgiving table, people that are from other parts of the country, people from other households, the virus is going to be sitting there with you. So just be very, very careful. Think about social distancing, masks, opening windows, doing this outdoors, screening people for symptoms, asking people to take a test. But we know we're going to get a surge after Thanksgiving. I think it's inevitable at this point.
Amesh Adalja, senior scholar, Johns Hopkins Center for Health Security. As always, we thank you for your time.
Thank you.